On March 10th, the Kaiser Family Foundation, together with the Peterson Center on Healthcare, released a new report called The Burden of Medical Debt in the United States. It pointed to that medical debt can happen to anybody across the United States, but it's more pronounced among people who are already struggling with poor health, financial insecurity, or both. And they also talked about some of the racial disparities for people living with medical debt. Some of the key findings are as follows. 23 million people, nearly 1 in 10 adults, owe significant medical debt. People across the United States owe at least $195 billion in medical debt. The report also says about 16 million people, or 6% of adults in the United States, owe over $1,000 in medical debt, while 3 million people owe medical debt that's more than $10,000. While medical debt occurs across demographic groups, people with disabilities, those in worse health, and poor or near poor adults are more likely to owe significant medical debt. And Black Americans, people living in the South, or people living in states that did not expand Medicaid are likely to have significant medical debt. Here are a couple more statistics, and this is on those racial disparity points that the report was highlighting. 16% of Black Americans report having significant medical debt. Women are more likely to have medical debt, and 12% of adults aged 50 to 64 have significant medical debt, and that's higher than the older age group, higher than those aged 65 to 79. You can read the report and its significant findings. We link to it in the description below. We also give you some resources if you find yourself living with medical debt. You can visit the Consumer Financial Protection Bureau's resources on how to challenge or ask questions about that debt. We also link to some of our own Fighting Forward medical debt guides in the description below.